My name is Hector Lopez. I'm a police officer with the Los Angeles Police Department. For the last 7 years, I've been assigned to LAPD's Mental Evaluation Unit. The Mental Evaluation Unit is the specialized unit that handles all mental illness calls in the city. The Mental Evaluation Unit was started in 1987. The department saw there was a need to address the needs of the mentally ill. Data collection started in 1987 with rudimentary hand counting of individual calls. We have a database of all police contacts with a person with mental illness or suspected mental illness. We've written it into our policy that every patrol officer is required to now contact the Mental Evaluation Unit to get guidance and support. There were over 15,000 contacts during that year. Well, what I discovered was that 70% of the contacts were actually hospitalized and diverted to mental health care services, whereas only 10% resulted in arrests, which is an important fact because in the past, officers did not have many other options other than arrest. So the fact that out of all the contacts we had in that year, less than 10% resulted in arrest is a pretty impressive statistic. Collect everything you can. The importance of data collection, you might not know what you might need in the future. The more data you collect at the beginning, the better, and be flexible. Your database is going to be refined over the years, depending on the operational needs of the department and the community you have. Our database has changed immensely since the very beginning. Internally, what we develop is risk factors. So we now keep track of statistics just as suicide by cop statements. We keep track of guns. We keep track of uses of force. And this information is imperative in order to better address the needs of the community. We can now better recognize when there's an issue or when someone might need additional follow-up care. And without the database, we would not be able to do that. So in keeping track of the statistics, we're able to provide a better level of service and be more preventive and not being reactionary. All that information is released to the patrol officers. However, we do safeguard the medical privacy of the patients. So we now have data and statistics to show the community, the command staff, and everyone involved that the programs are effective in doing what they were meant to do. One important aspect of the database is that you're able to then introduce an intervention and engage data pre and post that intervention to gauge the effectiveness of that intervention. A recent thing we did with the Los Angeles Police Department is the expansion of the Mental Evaluation Unit. We went from 8 teams a day to 17 teams a day. In order to gauge the effectiveness of what we're doing, we now access the data and to show that prior to the intervention, patrol officers handled 70% of our contacts with the mentally ill, showing that there was a need for more SMART teams in the city. Post-intervention, numbers are at where SMART officers are now handling 60% of the calls, and that's expected to continue to grow. So without the database, we would not be able to gauge the effectiveness of our intervention. For data, you need to have policies in place to figure out what you have. And then talk to other agencies that are in similar circumstances, or agencies that already have programs in place. See what they've learned from their programs. Sharing of information is important just because if something's effective in a neighboring community, you might be able to implement some of those programs or some of those policies into your own. The evolving database has been a matter of interest for the department, the city officials. It's something we can now use to better know the issues we have in the city, and then knowing what we have in the city, we could better address the needs of the community. If you don't know what you have, you won't know how to handle it.